Welcome back to the lecture series on repertories. Today we are going to see the topic General Instructions for Interviewing in Homeopathy for Mental Illness of Patients. The first point we'll see. To establish a good rapport, the physician must seek out, pursue and respond to the patient's emotions and emotionally charged area of concern. To recognize, respond to and empathize means ability to sense other people's emotions is to show compassion, warmth and genuineness. Now we will see the second point. Open-ended questions elicit a greater volume of talk from patients than any other type of enquiry. Third one. Such cases, complaining about their sorrow, lamentations means expression of grief and sorrow, should be observed silently with a feeling of sympathy in looks and gestures. The fourth point, the physician should remain attentive to the senseless chattering of the patient and in contrary should be inattentive to the disgusting bad conduct and conversation of the patient. Now we will see the fifth point. Because of hopelessness, depressed patient may not volunteer initially. Their feeling is that they cannot be helped should be carefully handled by the physician. If the physician decides that the patient is in imminent risk of suicidal behavior, the patient should be protected in a psychiatrically supervised setting. The sixth point we'll see. While dealing with the delusional patients, the physician should not challenge the patient's delusion directly, but he should indicate that he understands the patient's belief in the delusion to be true, but that he does not hold the same belief. We'll see the seventh point. The physician should only prevent the patient from destruction of the surrounding objects and injury without criticizing him for his acts. Now we will see the eighth point. Everything should be arranged in such a way that any corporeal punishment and tortures may be avoided. Now we will see the ninth point. As the homeopathic medicines in small doses which never offend the taste can be administered consequently by means of their drinks without the knowledge of the patient, the compulsion is unnecessary. Now we will see the 10th point. While dealing with a violent patient, the physician should take care of the following points. The first point, the interview of a violent patient should not be done alone. Second one, while dealing with a violent mania, the physician should remain calm, courageous, cool and with firm resolution. Third one, a calm, non-threatening tone of voice should be used because many violent patients are frightened and cover that with bravado, means bold manner, threats or violence. The fourth point, the physician should be firm and non-hostile in stating that violent acts will not be tolerated. Fifth one, confrontations with a violent patient should be avoided. Sixth one, hatred, angry, violent, threatening behavior tends to elicit a predictable range of emotions: fear, anger, disgust, and aversion. It is essential not to react personally to the provocations of violent patients. Now we will see the 11th point, contradictions, eager explanations, rude corrections, abusive languages, and also weak, timorous, means lack of confidence, yielding, are harmful to the patient as they arouse impatience and aggravates the complaints. The physician and the caretaker should pretend to believe them as they possess the reason. Now is the 12th point. All kinds of external influences that disturb the senses and disposition of the patient should be avoided. The treatment of the violent, insane maniac and melancholic should be done in an institution specially arranged for their treatment, but not within the family circle. About the scope of treatment of mental diseases, Hahnemann says, "Indeed, I can confidently assert from great experience that the vast superiority of the homeopathic system over all other conceivable methods of treatment is nowhere displayed in more triumphant, means having won a battle, light than in mental and emotional diseases of long standing. For each case of mental disease, the homeopathically suited remedy selected based on the faithfully traced picture of the morbid state, which includes the principal symptoms of emotional and mental state of the patient, leads to the most striking improvement. Thank you for listening the lecture on interviewing mental illness of patient. If you like the video, then please do subscribe and share. Thank you and see you soon with new video on homeopathy.